Okay, we're back with Nicole Gaddis again. First of all, you brought up something when you were sharing that personal story of your cousin right there, of a drug that perhaps could have been disposed of, and a lot of us have those drugs in our house that we don't know what to do with.
Yeah, probably you do. I know I do. So we recommend for everyone to go through the medicine cabinets at least once a year and clean it out. Just like when you think about doing your spring cleaning, go in and get your medicines cleaned out too. And we recommend it's safest for the environment if you dispose of them through an incineration program. So there's a program in St. Louis called the P2D2 program, Prescription Pill and Drug Disposal. You can find the sites for that on the St. Louis College of Pharmacy website or our Facebook page. And take them, drop them off. It's completely anonymous, so you don't have to worry about, oh, this isn't mine, I got it from somebody else. Mm-hmm. We want everything that we can get out of the homes to keep other people safe.
Okay, let's talk about the problem of misuse. Is misuse a problem, and what do we mean by that, I guess?
No, oftentimes misuse leads to abuse. So misuse is taking it in a way that wasn't intended to be taken, and it can lead to addiction, which is then termed abuse. And what we would want to try and prevent that with folks, for sure.
So I may not be after a particular drug to get high,
sure,
but there is still, these are dangerous drugs we're talking about.
Yeah, and let's be clear, there are legitimate reasons for these drugs too. They're really important to patients with cancer and chronic pain. We need them, but at the same time, they can lead to these adverse outcomes, and we need to protect society too. And so there's a balance of finding out what we should do about it versus keeping access for folks.
Okay, kind of in the same vein, what about not following through with the doctor's prescription that he is, not taking the drugs you're supposed to, or the doctor tells you to?
So that's non-adherence or non-compliance, not taking them as prescribed, and it's a really costly problem for society. 3 out of 4 people don't take their medicines as prescribed. I'm sometimes one of them, but it can lead to more adverse outcomes. So people that don't take their drugs as prescribed actually end up spending more in the healthcare system because you're going to end up in the hospital more often.
Okay, so how do we fight that?
So adherence comes down to, I'm going to put it back on you, Casey. If you don't take your drug, then you need to talk to your physician, your pharmacist about that and say, you know what, I'm not taking it, it's not working for me. So let's find alternatives. It could be non-drug, it could be a different drug that doesn't have the side effects that you're experiencing. So really we need to partly ask patients to step up to the plate and be honest.
So communication on the individual. But that can be tough if the individual is not complying, as you say, in the first place.
Absolutely.
Okay, when we talk about misuse or non-compliance, does ACA come into that, the Affordable Care Act? Do you see anything coming from the healthcare law there?
Well, there might be some ways that people are going to be able to afford more medications, so that's good, because then it can help compliance in the end. It can take down one barrier that they might have to taking their medicines. But remember, cost isn't the only barrier. So other reasons people might not take their medicines are side effects or perceived side effects. I hear that a lot. If I think it might make me woozy, and so I'm not going to take it. Also, just forgetting a lot. The number one reason for non-compliance is I forget. So talk to your pharmacist about, what are ways to remember. Put an alarm on your phone, pill boxes, those kind of things.
I'm sorry.